Hi everyone. Today we are going to discuss about difference between reversible and irreversible pulpitis. In reversible pulpitis, there is mild to moderate inflammatory conditions of pulp caused by noxious stimuli in which pulp is capable of returning to the uninflamed state following removal of stimuli. Whereas in irreversible pulpitis, there is persistent inflammatory condition of the pulp which can be symptomatic or asymptomatic in nature and it is incapable of healing, that is, the change is irreversible. Types of reversible pulpitis are acute and chronic. In acute, it lasts for short time, that is few hours or days, while in chronic for long time and pain occurs for months. Irreversible pulpitis can be of two types, asymptomatic as well as symptomatic. Then causes of reversible pulpitis. These can be trauma, thermal shock, excessive dehydration of cavity or irritation of exposed dentine at the neck of the tooth, placement of fresh amalgam filling in contact with occluding a cast restoration, chemical stimulus from sweet or sour food stuff. Trauma can be blow, disturbed occlusal relationship. Then thermal shock can be due to dull burr, which is used to prepare cavity, or from overheating during polishing. Then in irreversible pulpitis, the causes can be bacterial involvement of pulp through caries. Then reversible pulpitis may also deteriorate into irreversible pulpitis, and chemical thermal mechanical factors can also be the causes of irreversible pulpitis. Symptoms of reversible pulpitis are short, sharp pain, specific pain to a stimulus. Main important feature is it is relieved on stimulus removal. It is caused by cold. Mainly cold stimulus is responsible for reversible pulpitis than by hot food, beverages and cold air. Whereas the symptoms of irreversible pulpitis can be defined in two stages, early stage as well as later stage. In early stage, there is paroxysm of pain, which means there is sudden temperature change and the pressure change which can cause the paroxysm of pain. Then pain can occur due to hot or cold stimulus. Main important feature here is spontaneous pain, lingering pain even after removal of stimulus. Sharp piercing, shooting, severe pain, intermittent or continuous pain. Other main important feature is postural pain, which occurs in irreversible pulpitis. That is change of position, that is bending down or lying down, can cause pain. Referred pain, and in later stages the pain is boring, gnawing, throbbing. Nocturnal pain, pain increased by heat or relieved by cold. Then diagnosis of reversible pulpitis, it is diagnosed by nature of pain, application of cold, because as we know that it is caused by cold stimulus. Then pain or percussion is negative. Radiographically, there is no periradicular changes seen in reversible pulpitis, whereas in irreversible pulpitis we can appreciate grey scum-like layer over exposed pulp and surrounding dentine. Then surface of pulp eroded. Odor of decomposition is present, that is malodor or foul odor is present. Then if pulp is not exposed, drop of pus present. Radiographically, there is no periradicular changes, or it may disclose an interproximal cavity, may show pulp exposure, caries underfilling, deep cavity. In early and later stages, we can see in early stages there is thermal test which may elicit pain. In late stages, respond normal to thermal stimulus. Then diagnosis can be made by electric pulp test, and pain on percussion here is also negative because it is the disease of pulp, and in the pulpal disease the percussion test or tenderness on percussion is negative. Tenderness on percussion is always positive in case of periradicular diseases. Then differential diagnosis of reversible pulpitis is pain for several minutes or longer, reversible pulpitis, the differential diagnosis can be irreversible pulpitis if the pain lasts for several minutes or longer. But we know that reversible pulpitis, the pain lasts for seconds only. Now, in irreversible pulpitis, the differential diagnosis is acute alveolar abscess, where swelling, tenderness on palpation, and tenderness on percussion. Here, tenderness of percussion is also positive, so we can diagnose that it is not irreversible pulpitis. It may be acute alveolar abscess, where mobility and other systemic toxicity symptoms, for example, fever, nausea, are present. Then histopath. In histopath, reversible pulpitis, hyperemia to mild to moderate inflammatory changes are seen. Reparative dentine formation, that is formation of dentine by the stimulus to undifferentiated cells of pulpal tissue to form new dentine is known as reparative dentine. Disruption of odontoblast layer, dilated blood vessels, extravasation of edema fluid, and the presence of chronic inflammatory cells. Whereas in irreversible pulpitis, post capillary venules congested, necrotic areas seen, phagocytes seen, lysosomal enzymes, microabscess, etc. is seen. And in advanced stages, areas of ulceration, proliferating fibroblast, calcific masses are seen. Treatment. In case of reversible pulpitis, main focus on treatment is the removal of noxious stimuli. Then, in order to prevent reversible pulpitis, we can do early restoration if cavity develops. Then use a varnish or cement base before insertion of filling. Desensitization of neck of teeth where gingival recession is marked. Care in tooth preparation and polishing to prevent pulpitis. Then irreversible pulpitis, pulpotomy is the treatment, and in posterior teeth, pulpotomy as emergency procedure. Pulpotomy means complete removal of pulp, or we can say RCT is the treatment for irreversible pulpitis. Now prognosis. Talking about the prognosis, the reversible pulpitis have favorable prognosis if the noxious stimuli or irritant is completely removed earlier. Then in irreversible pulpitis, if the pulp is removed completely, then the prognosis is favorable for irreversible pulpitis. So thank you everyone for listening me patiently. Please like, comment and share.